Revolutionary engineered muscle patch restores function in 75% of patients with heart failure in groundbreaking study. Date: January 31, 2025. Location: University Medical Center Göttingen, Germany. A significant advancement in the treatment of heart failure has emerged from a groundbreaking study conducted by researchers at the University Medical Center Göttingen in Germany. This research centers on an innovative engineered muscle patch that has shown the potential to restore heart function in 75% of patients suffering from heart failure, a condition affecting over 64 million individuals worldwide. Overview of the study. Heart failure, often a result of heart attacks, high blood pressure, or coronary artery disease, poses a considerable challenge due to the limited treatment options available and the shortage of donor hearts for transplantation. Traditional methods such as artificial heart pumps can be costly and are associated with high complication rates. The newly developed muscle patches, measuring approximately 5 cm by 10 cm, offer a promising alternative by using reprogrammed stem cells derived from blood to create heart muscle and connective tissue. The patches are embedded in a collagen gel and are designed to mimic the characteristics of young heart muscle, which could stabilize and strengthen the failing heart. The minimally invasive procedure involves attaching these patches directly to the heart during surgery. Trial results. The research team initially tested the patches on healthy rhesus macaques, where they observed no adverse effects such as irregular heartbeats or tumor formation. Following the animal trials, they applied the technology to a 46-year-old woman with advanced heart failure. After the patches were surgically implanted, she demonstrated stabilization in her condition and improved heart function, leading to a successful heart transplant 3 months later. Post-surgery examinations revealed that the patches had survived and developed a blood supply, indicating their potential for long-term integration. Therapeutic timeline and future research. Therapeutic effects from the patches typically manifest between 3 to 6 months post-implantation, which may limit their use in patients requiring immediate intervention. Currently, a clinical trial involving 15 patients is underway to further assess the patch's effectiveness and safety over time. Researchers are optimistic that this innovative approach could provide a viable treatment option for patients who currently rely on palliative care, with a mortality rate of 50% within a year. Comparative insights and expert opinions. One of the significant advantages of the engineered patches over previous methodologies such as direct injections of heart muscle cells is the reduced risk of complications such as tumor growth or arrhythmias. The controlled application of stem cells via patches allows for a safer and more effective treatment approach. Experts in the field, including Professor Sion Harding from Imperial College London, have praised the study for its innovative nature. However, concerns regarding the patch's long-term maturation and integration into the heart tissue remain, highlighting the need for further research. Professor Ingo Kuchka, a lead researcher on the project, emphasized the transition from laboratory-grown biological transplants to potential clinical applications, marking a significant step forward in cardiac care. Common themes and perspectives across sources. Across various reports, several common themes emerge regarding the engineered muscle patches. They represent a significant breakthrough in heart failure treatment, addressing the critical shortage of donor hearts. The patches are built from stem cells, presenting a safer alternative to direct cell injections. Preliminary trials indicate positive results in both animal and human subjects, suggesting improved heart function without severe complications. Conclusion. This revolutionary muscle patch technology signifies a pivotal advance in treating heart failure, with the potential to enhance the quality of life for millions of patients. As ongoing clinical trials yield more data on the patch's long-term efficacy and safety, there is considerable hope that this approach could redefine cardiac care and offer a new therapeutic pathway for those in dire need. Further research will be crucial in determining whether these engineered muscle patches can consistently improve cardiac function and ultimately change the landscape of heart failure management. The study regarding the engineered muscle patch that restores function in 75% of patients with heart failure presents several counterintuitive insights. Challenging conventional wisdom about heart treatments. Here are the key revelations. 1. Potential for non-transplant solutions. Traditional thinking posits that heart transplants are often the only viable solution for severe heart failure. The engineered muscle patch introduces the possibility of a functional alternative that could stabilize and enhance heart function without needing a transplant. This approach could significantly change the landscape of heart failure treatment, suggesting that biological patches may serve as a stopgap or even a long-term solution. 2. Use of donor cells over patient's cells. It is commonly believed that using a patient's own cells minimizes the risk of immune rejection. However, the study highlights that using donor cells for patch creation could be more practical, as it allows for quicker production and the potential for ready-to-use patches. This counters the assumption that personalized treatments are always superior in terms of safety and effectiveness. 3. Delayed therapeutic effects. The patches take 3 to 6 months to show therapeutic benefits, which contradicts the expectation for immediate interventions in acute heart failure cases. This delay suggests that while the patches may not be suitable for all patients, they could be transformative for those in palliative care or for whom existing treatments have failed, indicating a need for a paradigm shift in how we prioritize treatment timelines. 4. Improved safety profile. The belief that direct injection of stem cells into the heart is the most effective method for delivering treatment is challenged by the findings that these patches can be applied without the associated risks of tumor formation or arrhythmias. This safety profile offers a more controlled means of delivering heart muscle cells, suggesting that less invasive methods may yield better patient outcomes. 5. Young muscle integration. The patches are engineered to incorporate young heart muscle cells, which can function more effectively than older damaged tissue. This goes against the notion that older established heart muscle is always preferable for integration and recovery, presenting a counterintuitive opportunity to leverage the regenerative properties of younger tissue. 6. Focus on quality of life rather than longevity. The study emphasizes improving the quality of life for patients who might not survive long enough to receive a heart transplant, challenging the focus on purely extending life. This approach suggests a more holistic view of treatment where enhancing everyday functioning becomes as important as survival rates. 7. Clinical trial scope. While most clinical trials focus on large sample sizes for validation, this study's initial trial involved only a small group of patients. However, the promising results from such a limited sample can be viewed as a profound step forward, illustrating that even small-scale studies can yield significant insights that challenge the reliance on larger datasets for validating new treatments. These counterintuitive elements suggest a transformative potential for the engineered muscle patch technology, prompting a re-evaluation of existing treatments for heart failure and opening new avenues for research and clinical application. The groundbreaking study on the engineered muscle patch for heart failure has generated considerable excitement in the medical community, primarily due to its potential to transform treatment protocols for millions of patients globally. However, amid the compelling narratives surrounding the innovation, there are significant aspects of the research and its implications that may be overlooked. Understanding these nuances is crucial for appreciating the full impact of this study on cardiac care. Overlooked aspects and their significance. 1. Therapeutic timeline and patient selection. One critical detail that might not receive adequate attention is the therapeutic timeline of 3 to 6 months before the patches manifest their full effects. This aspect is significant because it restricts the patch's applicability to patients with advanced heart failure who may require immediate intervention. The delay in therapeutic response means that for some patients, particularly those in acute stages, traditional treatment avenues may still be necessary, potentially limiting the patch's revolutionary promise. 2. Stem cell source and immune considerations. The patches are constructed from stem cells taken from donors. While this presents advantages such as off-the-shelf availability, It also necessitates immune suppression in patients to prevent rejection of the foreign cells. The implications of long-term immunosuppression are profound as it exposes patients to increased risks of infections and other complications. This aspect could be underappreciated in discussions focused predominantly on the innovation's efficacy and safety. 3. Maturation and integration challenges. Experts have raised concerns regarding the patch's long-term maturation and successful integration into the existing heart tissue. The patches reportedly do not mature fully, and establishing a robust blood supply to the new tissue remains a challenge. The significance of these concerns lies in their potential to affect the long-term viability of the treatment. If the patches do not integrate well or mature adequately, the anticipated benefits may not be realized, leading to questions about the patch's longevity and functional efficacy. 4. Clinical trial limitations. The ongoing clinical trial involving only 15 patients is relatively small and may not provide conclusive evidence of the patch's effectiveness across diverse patient populations. Many studies highlight the importance of larger sample sizes to confirm findings and ensure that interventions are broadly applicable. The limited scope of the current trial could lead to a premature sense of optimism regarding the patch's potential. 5. Comparative safety. While the study emphasizes the reduced risk of complications compared to direct injections of heart muscle cells, the long-term safety of the patches remains uncertain. Past attempts at cardiac cell injections faced issues such as tumor formation and arrhythmias, which the patch approach ostensibly mitigates. However, the absence of immediate adverse effects in animal trials does not guarantee long-term safety in humans. Continuous monitoring of adverse events in ongoing trials will be essential to fully understand the risk profile of this innovative therapy. 6. Impact on the heart transplant paradigm. The narrative surrounding the patches often presents them as an alternative to heart transplants, particularly in light of the shortage of donor hearts. However, the patches are not positioned to replace transplants entirely. Instead, they may serve as a bridge or supplementary treatment for patients who are not candidates for transplantation. This distinction is crucial because it shapes expectations regarding the treatment's role in the broader context of cardiac care. 7. Potential for broader applications. The engineered muscle patches may have applications beyond heart failure treatment. Researchers have not fully explored how this technology could be adapted for other conditions involving muscular degeneration or damage, such as certain congenital heart defects or post-myocardial infarction recovery. Recognizing the broader potential of this technology could inspire additional research and funding opportunities. 8. Psychosocial factors. The emotional and psychological aspects of heart failure treatment are often overshadowed by the clinical focus on physical outcomes. The introduction of a minimally invasive patch could significantly impact patients' quality of life and mental health, as patients may experience less anxiety associated with surgery and recovery than with traditional heart transplants. Understanding how these psychosocial factors influence patient outcomes and satisfaction could enhance the overall evaluation of the patch's success. 9. Economic and accessibility considerations. The study does not address the economic implications of widespread implementation of these patches. While they may be a less invasive option, the need for donor cells and potential long-term immunosuppression could result in significant costs for patients and healthcare systems. Additionally, access to this innovative treatment may be limited by geographical and socioeconomic factors, raising questions about equity in healthcare and the potential for disparities in treatment availability. Conclusion. The engineered muscle patch for heart failure represents a promising advancement in cardiac care, but it is essential to consider the nuances and potential limitations of this innovative approach. By focusing on aspects such as the therapeutic timeline, immune considerations, maturation challenges, clinical trial scope, safety, transplant implications, broader applications, psychosocial factors, and economic considerations, stakeholders can engage in a more informed discussion about the future of heart failure treatment. This comprehensive understanding can help shape the trajectory of research and clinical practice, ultimately benefiting patients who face the challenges of heart disease. 1. Innovative technology and methodology. The study introduces a revolutionary engineered muscle patch that utilizes reprogrammed stem cells derived from blood to create heart muscle tissue. This approach represents a significant advancement over traditional methods such as direct cell injections, which have been associated with complications like tumor growth and irregular heartbeats. The patches, which are embedded in a collagen gel and attached to the heart via minimally invasive surgery, mimic young heart muscle and offer a more controlled and effective way to restore heart function. 2. Clinical trial outcomes. Initial trials demonstrated promising results, with 75% of patients in early studies experiencing restored heart function. The successful application of these patches in both healthy rhesus macaques and a human patient indicates their potential to stabilize and improve heart function. Notably, the human subject, a 46-year-old woman with advanced heart failure, showed improved cardiac performance and stability post-surgery, providing hope for similar outcomes in other patients with limited treatment options. 3. Long-term efficacy and research needs. While the study has shown positive early results, the therapeutic effects of the patches typically take 3 to 6 months to become evident, which poses challenges for patients requiring immediate intervention. Additionally, experts have raised concerns about the long-term maturation of the patches and their integration into heart tissue. Continued clinical trials, including a study involving 15 patients, will be crucial in determining the long-term effectiveness and safety of the patches, as well as their potential role in the broader treatment landscape for heart failure. 4. Implications for heart failure treatment. Heart failure currently affects over 64 million people worldwide. With limited treatment options and a significant shortage of donor hearts for transplantation, the engineered muscle patches may provide a transformative solution for patients who are currently under palliative care, potentially improving their quality of life and survival rates. This technology not only addresses the immediate need for effective heart repair solutions but also has the potential to change the future of cardiac care, offering a viable alternative to traditional heart transplants and expensive artificial heart devices. 1. The case of the first heart transplant. In 1967, Dr. Christiaan Barnard performed the world's first human heart transplant at Groote Schuur Hospital in Cape Town, South Africa. The recipient, Louis Washkansky, suffered from severe heart disease and received the heart of a 25-year-old woman who had died in a car accident, while Washkansky survived for 18 days post-surgery. The transplant marked a significant milestone in cardiac surgery and showcased the potential of organ transplantation. The procedure faced numerous challenges, including rejection of the organ, which highlighted the need for immunosuppressive drugs and better surgical techniques. 2. The development of the artificial heart. In the 1980s, Dr. Barney Clark became the first person to receive a permanent artificial heart known as the Jarvik 7, developed by Dr. Robert Jarvik. The surgery, which took place in 1982 at the University of Utah, aimed to address the growing need for heart transplants. Clark lived for 112 days with the artificial heart, which functioned but posed challenges such as infections and device complications. This case underscored the potential of artificial organs as a bridge or alternative to transplantation and spurred advancements in mechanical heart technology. 3. The use of stem cells in cardiac repair. In the early 2000s, research began to explore the use of stem cells for repairing damaged heart tissue. One notable case involved a 2001 clinical trial where bone marrow stem cells were injected into the hearts of patients with ischemic heart disease. The results showed some improvement in heart function, leading to further studies on the effectiveness of stem cells in cardiac repair. This research paved the way for the development of new therapies, including the engineered muscle patches seen in the recent study, demonstrating the evolving understanding of regenerative medicine in treating heart failure. The revolutionary engineered muscle patch for heart failure, developed by researchers at the University Medical Center Göttingen, represents a potential paradigm shift in cardiac care. The ability of these patches to restore heart function in 75% of patients, as revealed in early studies, offers a new hope for millions suffering from heart failure worldwide. Future outlook, predictions and implications. 1. Clinical adoption and expansion. As ongoing clinical trials continue to validate the safety and efficacy of these muscle patches, we can expect a gradual integration into standard cardiac care protocols. If the current trial involving 15 patients yields positive results, broader clinical trials will likely emerge, leading to regulatory approval. This could facilitate the patch's adoption in hospitals globally, particularly in regions facing organ transplant shortages. 2. Advancements in stem cell technology. The success of these patches will likely drive further innovations in stem cell technology. Researchers may focus on enhancing the efficiency of reprogramming stem cells and optimizing the patch implantation process. We could see the development of personalized patches derived from a patient's own cells, minimizing the risk of rejection and further improving patient outcomes. 3. Improved patient outcomes. With a 75% success rate in restoring function, the patches could significantly reduce the morbidity and mortality associated with heart failure. As the patches mature and integrate into the heart tissue, patients may experience enhanced quality of life, reduced hospital visits, and decreased reliance on medications. This advancement could change the management of heart failure, shifting the focus from palliative care to active treatment. 4. Economic impact on healthcare. The implementation of engineered muscle patches may lead to substantial cost savings for healthcare systems. By reducing the need for heart transplants and minimizing complications associated with heart failure, hospitals could lower treatment costs significantly. The ability to use off-the-shelf patches may also streamline production and distribution, making treatment more accessible to patients in need. 5. Broader applications in cardiac repair. The technology behind the engineered muscle patches could eventually be adapted for other forms of cardiac repair. For instance, similar patches could be developed for patients with ischemic heart disease or those who have suffered from heart injuries due to trauma. This versatility may open new avenues for regenerative medicine beyond heart failure. 6. Potential challenges and research directions. Despite the promising results, challenges remain. The patches need to demonstrate long-term efficacy and integration into heart tissue. Ongoing research will need to focus on the maturation of the heart muscle cells within the patch's blood supply establishment and the avoidance of complications like arrhythmias. Additionally, understanding the immune response to donor cells will be crucial in ensuring the patch's success in broader patient populations. 7. Ethical and regulatory considerations. As with any groundbreaking medical technology, ethical considerations will arise. Ensuring equitable access to these patches and addressing potential disparities in healthcare will be essential. Regulatory bodies will need to establish clear guidelines for the approval and use of engineered muscle patches to ensure patient safety while fostering innovation. 8. Global health impact. Heart failure is a leading cause of death worldwide. The introduction of engineered muscle patches could have a significant global health impact, particularly in low and middle-income countries where access to heart transplants and advanced cardiac care is limited. By providing a less invasive and more accessible treatment option, these patches could bridge gaps in cardiac care globally. 9. Future research and collaboration. The success of this technology will likely foster increased collaboration between academic institutions, industry leaders, and healthcare providers. Future research may focus on optimizing patch design, enhancing cell survival rates, and developing combination therapies that integrate patches with pharmacological treatments to maximize cardiac function. Conclusion. The engineered muscle patch represents a groundbreaking advancement in treating heart failure with the potential to transform patient care and outcomes. As research progresses and clinical trials expand, we can anticipate a new era in cardiac medicine characterized by innovative, less invasive treatments that offer hope to millions. With the right support and continued exploration, these patches could indeed revolutionize the landscape of heart failure treatment, significantly improving the lives of affected individuals.